and gentlemen, welcome back to the Dog Talk Podcast with Dr. AJ and Dr. MJ. What's up, bro?
Good to see you, man.
You too, bro. You're looking good today.
I know. I feel good. Actually, you look good. That's why you said that.
Okay, I do look good.
I think you said that so I can give you a compliment.
I'm waiting.
You look good, honestly.
Thank you. Honestly? Were you lying initially?
You know, when you say honestly, you don't want to hurt the person's feelings. So
Well,
you're just like,
I got complimented a lot today, even by
That's good.
Jason.
Jason?
Jason complimented me today.
That's
Yep.
rare.
Yeah, Amanda's the only one that didn't compliment
Yeah.
me.
Well,
Yeah, it's all
she
good.
usually only compliments me.
Yeah,
so
it's all good. That's fine.
normal.
That's all good. That's all good. How you
What are
doing?
we doing today?
Today we're doing video reactions to medical shows like House MD, Scrubs, ER. There's so many shows that
And
show
there's a lot of people
of
that like have their favorite shows. Let us know what you want us to, what do you want us to watch, and let you guys know if this is what really happens in the hospital or kind of just for film.
It's just I feel like there's a lot of things that they add to these shows that just really don't make any sense. So I figured it'd be kind of
I
funny
laugh
for us
every
to
time
just
I watch it. And every time I watch the show with somebody, they always ask, does that really happen?
Yeah,
Because
exactly.
People don't know. If you don't work in a hospital, you don't work in a clinic,
Exactly.
you don't know.
Exactly. So that's what we're gonna do today. So today we have two skits from House MD that we're gonna discuss, two clips, and I think it's gonna be pretty fun. I think the viewers are gonna love it.
Let's see it.
You ready?
Ready.
All right. So this one is an episode. So supposedly this guy wakes up from a 10-year coma, which is kind of interesting. So
I haven't seen this one, actually.
yeah, me neither. So let's check it out here.
The amount of amphetamines alone would be dangerous.
Okay, so
Besides whatever the hell else you've got in there.
Okay, so there's three doctors that are
South
just.
Africa about a pill that'd temporarily revive someone.
They
in a
do look
vegetative
tired. They must have been
state.
working hard.
All seen awakening.
So he just said about this drug is from South Africa, about a pill that can revive a person from a coma, but this is an injection.
No consent.
Yeah, but I just look at him, right? So he's like,
I mean, you can't really get a consent from a guy in a coma.
I just don't know why he said
Family
pill
members.
and now he's injecting. So how is that a pill?
Wait, he said pill?
He said pill. So let's finish it up here. Hold on.
Made me cry. I want to cry.
Okay.
Put the syringe down.
All right. All right. So they.
I can now draw you,
Corporate
mysterious
Zen.
stranger.
We don't experiment on helpless.
He's funny, though.
He's pretty funny.
Reasonable. There's no way this is gonna work.
Patient
Even
is
if you
helpless.
woke him, it would only
Well,
be
first
for
of all,
a
can we
few
look?
hours.
If you look back at the patient,
He looks amazing.
He looks great.
10 years?
10 years in a coma.
I don't
There's
think I've ever seen a patient in a hospital
no
for 10 years.
decreased muscle tone, no signs of malnourishment. I
He
don't
looks
get it.
healthier than me.
Yeah, and there's what is it, like one line of IV connected to him?
Way this is gonna work.
Even if you woke him, it would only be for a few hours, a day.
So he's going to
two
wake
at
up from the coma
most.
for
You're
sure, and he's only
risking
going to
his
live 2-3
life.
days. That's
I'm risking
what she's
getting
saying so
sued.
far.
That's
Yeah,
the only
yeah.
objection here.
And
You'll be
the
torturing him.
Yeah,
and
so
his
I mean,
family.
his family doesn't know. There's no consent form,
He's not wearing
These guys
gloves.
upstairs
No.
dying.
No gloves.
Hey!
and he just
Injected
injected it.
without family consent.
Let's check this out here. What is he gonna wake up?
I want this patient monitored.
What
for the next
if they?
24 hours.
I want him
they
monitored
monitored.
for
He's been in a
24
coma
hours.
for 10 years and they're not monitoring him. I don't get.
I want
Monitor him
your
for 24 hours.
Yeah, I don't.
my office.
Well, he's not even connected to anything. He's not even
I don't
connected
see
to
any
the
connection.
monitor.
Exactly, nothing.
Darn
Oh God, he's moving.
it. I could really go for a steak.
Oh, he's starving. Of course, 10 years.
So after 10 years, that's the first thing. I feel like that's what you would say if you were to wake up after 10 years.
Did he said he wants a steak.
Oh my God.
Look at his
Did you
face.
say steak?
It looks pretty good though. Look at him.
Oh
10-year
my
coma.
God. Hey, AJ, pause it real quick. What would be the first thing you want if you wake up from a coma in 10 years? You're laying in bed. 10 years later, you wake up. What would be the first thing? Honestly, steak. I don't blame the guy. Like,
I mean, a nice steak, maybe medium rare.
like 10 years later, you wake up. And
I'll
the
take a
steak-
nice steak. It
Yeah.
depends where we're gonna get it from, but a nice
Yeah.
steak sounds pretty good.
He didn't ask. He must have not cared about his wife because he woke up, didn't ask about his
About his
wife, didn't
family,
ask
he
about
wants a
his
steak.
kids. He asked about a steak.
The first thing I would probably want, honestly, is water.
Water, yeah.
I would want something.
Because he's
to
not
drink.
getting IVs.
Yeah, I know exactly.
needs
I don't see
something.
anything connected to him, so I'd want water as the first thing. So that was pretty funny, actually. That was a good episode. Let's see here. Let's see. Let's check out another one here.
What's your favorite out of them? House, Grey's Anatomy.
I don't know. I feel like there's a different connection with each show. I think that House possibly has a lot of different pathology and diagnoses versus
I actually like what he does on the board.
Yeah,
I
he
do that
does.
with some of the patients.
Yeah.
I put the symptoms to
exactly, and I like that. I like he gets
Yeah.
together with his team. They talk about stuff. Grey's Anatomy has a lot of
So
emotional
exaggerated.
roller
And
coasters
we'll do a little bit of
exaggerations.
videos,
Like I don't
yeah.
believe a neurosurgeon can go ahead and do an open heart surgery. It just doesn't make any sense to me. But
And for everybody that watches these shows, guys, please in the comments. Get a little bit more involved. Let us know what show you want us to react to.
Exactly.
Anyways,
and ask us some questions.
We're not done, so let's keep
Let's get this
watching
rolling
this.
here. So this is here.
Another
so
house
this show is called
episode.
Insensitive. So let's see here. Let's play it. This patient is on an operating room bed.
Hang on, how do you wait?
Let me play it real quick here.
Yeah, play it.
Gave her nitrous during the EEG. That's what made this
You
thing
gave her
rear its
nitrous.
ugly.
What thing?
B12 deficiency.
Are you having deja vu? We've had this
Okay.
conversation. She was given
Well,
B12.
so
she didn't get better.
None of them are
Someone
wearing
else needed
masks.
Get an abdominal MRI.
What?
He wants an
What are you
abdominal
doing?
MRI.
Don't touch me!
Okay.
Here she goes.
She's fully awake
Paranoid
and
delusion.
She has cuts everywhere, but she only has band-aids on 2
Get the
spots.
MRI within an hour.
yeah. Here, let me see.
Occupied!
Okay,
Hernia
so
can wait.
Help! They're trying
Wait, time out.
Okay.
There's somebody already in the surgery room,
yeah, so there's
and
so
they
there's,
took her in the same surgery room to do the surgery.
So there's no other operating rooms. I don't get it.
And the way he
Easier ways to kill somebody.
Bev, help them.
you don't scrub in like that.
Yeah.
He didn't wash his hands. He didn't do anything. That's not the way you scrub in.
Yeah.
Largest salad bowl. Okay, hold her down.
Okay, so I'm hoping to God he's gonna
Come on, weenies. She's in a cast.
use some anesthesia. If he's- Oh God, don't tell me he's gonna cut her up while she's fighting. This is so unethical and
You're not
illegal.
gonna
By the way.
anesthetize her?
Relax. It's just a magic trick.
Yeah, he's a house. He's playing God right now. Oh, this
Said,
is
no,
just,
I'm gonna
this
do a
is
magic
disaster.
trick.
This is
Oh
a
wait, time out.
disaster.
If she doesn't feel pain, why is she screaming? Only when he like cut right at that moment.
Yeah, well, see, well, here, look at this.
Hey, keep that retracted.
Okay, so she's not feeling any pain. Bro, this is a disaster. You know how painful
But I
that
thought
is?
he wanted an MRI first.
Well, it's House, bro. He's playing God. What's that?
And for the people that love House, guys, don't take it so personal.
Oh, is that a tapeworm? Okay, that's
Lake
pretty large.
fishing can be fun. It can bring the generations
Where's your mask,
together.
buddy?
If you don't cook that trout or perch well, you'll be giving room and board to this
The
fella.
residents are freaking out.
Look at
It's
the
his-
patient. Look
It's
at
his
the
first day.
patient's
It's his first day. He's an intern. He's freaking out.
I can have a taper in
The
me.
patient is just like,
Likely. You'd be
I
in
could
a
have
lot
a
of pain.
tapeworm in me? You don't, what is he doing?
Oh my
great.
god.
Oh, nice job.
She just pulled out her old
Great.
cell phone. Did you see the flip phone?
Yeah, look at
And
football.
took a
And they're
picture.
wearing sterile gloves.
World record's over 60.
Okay, so maybe this fact, we'll check that out. Yeah, that was pretty disgusting.
That does not happen in real life.
Yeah.
But you know what? If you want to keep people entertained and
And they'll try that out.
chop them up and take out a.
Yeah, I should have mentioned that this is pretty bloody and.
Oh yeah, guys. For
pretty
anybody
invasive.
that's doesn't like seeing blood, don't watch these episodes.
Yeah, so I don't know what the hell he was doing there. To be honest with you,
Because House is supposed to be that guy that kind of like diagnose things that no one else can diagnose and discover
I get it.
treatments that
He's
no one
smart.
else. And he likes to try different things.
yeah,
The problem is that everything he does is against HIPAA, right? So
Yes.
and everything is unethical. Doctors don't
not
do
sanitary.
this. Yeah,
It's not, it's not
you know, there's-
sterile.
I've had people say that they've been to hospitals and they kind of get treated like this, but obviously it's not the way it's.
I
supposed to.
understand if we're in like war
Yeah,
and there's certain blood everywhere, patients are sick, bleeding. Yeah, but I mean, this is a full blown hospital with other operating rooms. You could have gone on another
Can't do all
operating room,
that.
no anesthesia. But that was pretty funny. That
yeah.
was pretty funny.
If you want like entertainment, it's good, but it's not real medicine.
Yeah, absolutely not. Like the other episode with that medication that he used. It's just-
I'm just gonna take it out and give him the injection.
Yeah, sure. And he just woke up, wants a steak.
Look, I'll tell you, sometimes though, like bad things do happen in surgery rooms and stuff like that, and you don't always have to get a consent when you're trying to save their life.
I get it, but
But-
it's not perfect. But it doesn't mean that you can't try as much as you can to reduce infection.
Yeah.
Right? Because that right there
100%.
should.
He
Yeah,
did, but he did use betadine.
oh, great. Yes.
I saw the betadine.
Yes, with no
That-
mask on.
So
Yeah.
no mask on, betadine,
Yeah, exactly. No
and then
anesthesia.
I don't know if she felt
Completely
pain or
open
didn't feel
abdomen.
pain.
Yeah,
Because first they
exactly.
said she needed anesthesia,
Yeah.
but then he cut her open. She screamed, and then she didn't scream right after.
Yeah.
So
No, that's
she's a
pretty-
very tough woman. I'll give it to her.
Well, she was probably surprised to see that.
I'll tell you a
25-foot
story.
tapeworm.
When I was my first year of medical school, I was scrubbing into a surgery.
Yeah.
Nervous. You know how it is when you scrub into a surgery. You're
Yeah.
freaked out. You have to make sure they're always yelling at you. You
Yeah.
time in,
Yeah.
make sure that the time of surgery. So I walk in, I'm rushing in. I put the mask on. I put the mask on backwards.
Of course you
So you
did.
know how the mask you have to put the metal part and close
Yeah.
it off. So I put it
Yeah,
the
the cut,
opposite
yep.
way. And with this lady, they were cutting fat, and sometimes they use, they burn the fat.
Yeah.
and they're burning up the fat, and the smoke is going up into my nose, and I'm feeling the nausea, and as I'm like leaning on the guy, he's pushing me.
Yeah.
And right after that, I passed out.
You're kidding me.
Yeah, that was my first time.
Did
So
you get
things
kicked out of that
happen.
rotation?
Yeah, he didn't like me after that, and honestly, I didn't know if I wanted to be a doctor after that because I don't, seeing blood, the smell. Some people are just not like, but then you get used to it.
You do get used to it. You do.
What was your first experience? Like your first experience in a surgery setting?
Well, honestly, I think. Well, let me discuss my worst experience. I was a 30-year resident, and I got called into the ICU for a code blue. Young patient. He needed to get intubated, right? So, I mean, he was desatting. I took the tube and I took the laryngoscope, trying to get the tube in. He gagged. He had a huge stomach bleed. All of his blood in his stomach came gushing out of his mouth into my face. It was pretty disgusting. It was all over me, and I had to get tested for Hep B, for HIV, and they put me on treatment for 6 months because it was just contamination
every time before every episode.
It was pretty disgusting. It was pretty disgusting. But you know what's funny is that during these type of situations, I forget. How bad it is. All I care about is
when
take
you're a
care
doctor,
of the patient.
your mental,
it's like a light switch, right? It didn't bother me. It's just like I need to save this patient.
You have to do something about this. Right?
I need to jump.
And that's
on
what I
save
always
this
say.
patient.
Like some of my friends ask me, like, hey, when you do OB or you're working with women, like, what is it? No, man. When you go in that room, you're automatically a doctor. Your mindset changes completely.
Yeah, you're right.
Since we're talking about stories, I was in Cook County in Chicago.
Yep.
They called me down. I was doing OB. And this lady comes in, and she was on, she just did cocaine and stuff like that. You could tell that she was kind of freaking out. And she's like, man, I got something cold on my leg, I pulled up the drapes. She had a baby. She didn't know she was pregnant.
You're kidding me.
Yeah, she didn't know she was pregnant.
Was it a miscarriage?
Huh?
Was it a miscarriage?
The baby,
oh my God.
We took out I didn't know there was a baby there. The baby was out. The umbilical cord was out. She had no idea she was pregnant.
Cook County.
Yeah, Cook County, Chicago. And at that, I was literally, my first year residency was nervous, freaking out. But again, you fall in these situations, you figure out what to do when you're in them,
That's good, man.
And if anybody has cool stories, all the people that watch our show that are in medicine, nurses, doctors, whatever they are, if you got some cool stories, let us know.
Yeah,
we'd love to hear them.
We got a lot of tips coming. We're going to do a lot of these videos and reaction to these videos, so there'll be a lot more coming.
Let us know if you like them. If you like
absolutely,
them,
and if you don't, let us know. Give us some advice and see what you like, and we'll change it up. So I think that's pretty good for today. You good?
Yeah.
All right. We'll see you on the next one.
Sounds good.
Thanks, MJ. Later, buddy.